And
Nope.
Diary.
All right, go ahead, Landon.
All right. Hi, everyone. We are Group 6, and our presentation is on advocacy organizations. Our group members are Amanda Darnell, I'm Landon Day, Samantha Board, and Shelby Ruiz. I'm just going to start out by defining advocacy. Advocacy is defined as public support for or recommendation of a particular case or policy. Advocacy is any action that speaks in favor of, recommends, argues for a cause, supports or defends, or pleads on behalf of others. So advocacy organizations use various forms of advocacy to influence public opinion or policy. They have played an important part in political and social systems for many types of organizations. And just moving on to professional organizations. Professional organization, also known as a professional association, which is usually what it's more commonly known as, is usually a nonprofit organization seeking to further a particular profession and the interests of professionals engaged in that specific profession, as well as the public interest in that profession. And there's some just examples of professional organizations for you guys that you can see right there.
Advocacy group versus professional organizations. Advocacy groups support political or social causes, recommending changes to laws, public policy, and in government. They change by influence through public education, lobbying, media activity, coalition building, grassroots activities such as protests, rallies, and demonstrations. It is the merging of professional groups that builds the coalition, the driving force. Because professional groups are aware of current issues, they are critical to advocacy groups. Professional groups help to train and teach members to be advocates for their patients and the issues they encounter. By collaborating agendas and priorities, organizations are more effective when advocating for their patients.
Some principal advocacy organizations within the healthcare sector are the AHA, American Hospital Association, which represents nonprofit hospitals. Them when it comes to legislation concerning healthcare and other aspects. There's also the Federation of American Hospitals, or FHA. It represents for-profit or proprietary hospitals. Their basis is that proprietary hospitals are beneficial to the community because they better the economics as well as are able to provide quality health care to the patient. Other than just hospitals, there's advocacy organizations within the healthcare for specialists and providers such as nurses, and the AMA, as well as the American Medical Association, which advocates for physicians. Other than advocate organizations, there's also professional organizations within healthcare, and they're key to bringing together those professional skills in their career or subject. Having this alliance, they're able to swap ideas to better the field and get information to better their own careers. Advocacy groups need professional organizations to be successful, and they are really well at working together. Some professional organizations in healthcare are the American Nurses Association, which is also an advocacy group, American Health Information Management Association, the American College of Healthcare Executives. All sides in healthcare need and have resources for support from the administrators to the patients and the givers.
Sorry, Shelby, I actually muted you a while back. I thought I would be able to control it, but I can't control it. So if you could actually go back to your the presentation, I can show you how to unmute yourself. So just go up to the top, and
Okay.
there you go. Sorry.
Okay, no problem.
No problem.
Let's put it okay. So mine was to identify these organizations that have both an advocacy and professional function. Can they do both? So the answer was yes, they can do both. An advocacy organization's main function is to help resolve issues with about healthcare, medical bills, and job discrimination related to a patient's medical condition. A professional healthcare organization is usually a nonprofit organization seeking to further a particular profession, the interests of individuals engaged in that profession, and the public interests. And then I went on to give a few examples of these organizations. So the first one was the American Association of Healthcare Administration Management. And some information about that was that the AAHAM was founded in 1968 as the American Guild of Patient Account Management. And it was initially formed to serve the interests of hospital patient account managers, but has evolved into a national membership association that represents a broad-based constituency of healthcare professionals. The next was the Healthcare Administration Association, and that one was also formed in 1980 as the Independent Administrators Association. It is California-based, nonprofit, and acted as a legislative and regulatory advisory group for third-party administrators and also related service providers. Another one was the American Nurses Association. That one seems to be kind of popular. So the American Nurses Association is a professional organization to advance and protect the profession of nursing. It started in 1896 as the Nurses Associated Alumni and was renamed the ANA in 1911. And lastly was the American Public Health Association. It was based in Washington, D.C., is a professional organization for public health professionals in the United States, and founded in 1872 by a group of physicians. The APHA has more than 25,000 members worldwide. Okay, and that was the end of mine.
Joining a professional group. Besides joining a professional group to help become an advocate for healthcare practices, staff, or patients, a professional group will also help you network for your career. You can expand your network locally, nationally, or globally, depending on the organization you are a part of. Often, websites of professional groups will list job advertisements. Headhunters will seek out members of professional organizations to fill roles. You can attend conferences to network in person and or to get continuing education. Also list this membership on your resume. Joining a group or organization can be as simple as viewing their website and submitting an application, though typically there is an application fee, annual fees associated with membership. Thank you.
All right. Oh, there we go. All right, great work. Professional organization, advocacy organizations, they are, they're an important part of healthcare administration. Help, if it's an advocacy organization, can really help different organizations move their agendas along. As you guys mentioned, they're there to help lobby to move those initiatives forward. Advocacy organization, professional organizations are great for as far as helping you progress your career and get that networking and education piece. So they're all really important pieces. So all right, typically I will ask people what the most interesting thing was that they learned while they're studying this. I don't really grade on it, and since it's probably pretty late for some of you, I'm not going to ask that question. So I'm going to go ahead and just stop recording now, but go ahead and